All right, so this time we're gonna do a wound cleaning. Patient is here for a wound cleaning. We already have gone through registration, rooming, and as a medical assistant, I reviewed her chart, confirmed her identification, and now what I'm gonna do is I'm gonna open the wound, open it up, look at it, do my inspection, and then I'll have my provider come look at it, confirm it for me for the next step. So, very gently. It can be for a suture removing, it can be for like a repacking, depending on what wound cleaning our patient is here for. Ow, you okay? So as we're in here, what we're gonna do, if this is like right now, pulling it, I don't think my patient is in pain. How are you doing, Miss Helen?
I'm good.
You doing good?
Yeah.
Okay, let's just say that, is it hurting you a lot?
Yeah.
Oh no, I'm sorry. So what I would do, I would grab like a gauze and with some water, sterile water, and I would just like gently like put a little bit water around it. Before I open it, it helps loosen up. You still doing okay?
Yeah.
Perfect. It makes like a sound that it's really hurting. Okay. Dun, 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 dun. All right. So I went all around, and I'm then going around. I'm gonna gently, sometimes this can be sticky, so we might have to do the same thing. Just gently gonna lift this. We're gonna make sure that we do not throw our gauze or our bandage, anything that you open from your patient, until your provider looks at it, and then you inspect it very well for documentation purposes. So let's say I'm going to inspect the wound, I'm going to inspect what I opened from my patient, and I'm going to make sure that I have this all information for my documentation. Right now I would see that, oh, there's still some blood which has already been dried, but at the same time I see that its skin gets a little bit red or swollen or tender. Pressing it, the patient complains, hurts. So anything that happens, we're gonna make sure we document that. If there's any discharge, we're gonna take all those notes. So before I do anything, I'm gonna confirm with my provider. The provider comes look at the patient wound, and he or she says, okay, it's ready to go ahead and have it clean and then repack it. This time the provider wants us to just clean it and then pack it the same way that it was packed. So what we're gonna do is we're gonna, of course, anytime we go from a dirty procedure to a clean procedure, we're gonna take our gloves off, wash our hands, and then put a new set of gloves. So I just cleaned this, just open the wound, which was a dirty, and now I'm going to a clean, which I'm going to want to clean up. So I would wash my hands, change my gloves. And then I do want to rinse a little bit because I see some blood, dry blood in there. So I'm gonna make sure to clean it a little bit, see whatever I can take out on those dry bleeding, I'll take it out. All right, I don't want to make a mess, so I'm just gonna lift this up, put it under here, or if you have a basin or anything in your office, just gonna gently rinse some sterile water in here to clean that. And if you don't have a syringe, you can just get your sterile water and start spilling over your patient's injured area too. That's okay too. So this is a wound cleaning. We're gonna make sure that ask the proper questions as well. Okay, and go ahead and lift it up and put it down. So depending on your clinic, see which ones you have, but in here, this is the isopropyl that I have. I made sure that my patient is not allergic to it, and this is not expired. So I'm gonna grab this. So there's 3 swabs on this one. The way we clean this, we start from the middle, the wound area, and then we work our way out. I would make smaller circles so I'm not missing anything. And you can also like turn your swab around for a better cleaning. Never ever come back to the clean area that you just went. And I'm gonna get my second swab. ink is coming off. About 2 inches away from your wound. This is my third one. Okay. Now that I'm done with it, I'm gonna give it a second. I'm not gonna wave or blow over it. I'm gonna give it a second to dry. And since the provider said to go ahead and repack it the same way that I opened it up, and there was some bacitracin on my patient, so I'm gonna make sure that I have my applicator swab and it's not opened, that it is contaminated. So I'm gonna open this up, get my bacitracin or the ointment that the provider ordered, confirmed everything here again. Start from the circle, way my work way out. Then, and if I need more, then I can get some more and go for it. And I have my gauze. So if it was the stitches right now, I would put the one that has plastic so it doesn't get stick to the patient's stitches. But if there's not any stitches, I can also put a steroid 4x4, 2x2 based on what we have on our clinic. There are different methods people or providers order. So we can just go from here, put some tape on it and call it good. Or we can just put a bandage on it and call it good, based on what the provider says. But while we are at it, I'm just gonna show a few way of bandaging as well. So we have a spiral bandaging. So I'm gonna show a spiral bandages, which we start from distal to proximal. We always make 2 rounds on the first, and as we're going, we're gonna make sure like we have 2 fingers space in between. And the reason I'm doing a reverse spiral is the provider wants a little bit of pressure, not a lot of pressure on my patient arm. And as I'm coming up towards the AC area, I'm gonna make sure that I'm not too close to the AC area. And I never come back to the same area again. Just gonna go over it and tie this up. Now I wanna make sure that this is not too tight for my patient. So I'm gonna get 2 fingers and put it under here, making sure that it's not too tight. And the collar should be the same on this both sides. It doesn't work as a tourniquet. And then I'm gonna just also ask my patient, how are you doing? How are you feeling?
Feeling good.
Perfect. So this was a spiral. I wanna show you guys how to do a reverse spiral while I'm at it as well. So we're just gonna open this up. As I'm opening it up, I just wanna make sure that it's always easy to have your bandage rolled when you're about to make a spiral or reverse the spiral.